Hi there, Fidel. How are you doing today?
I'm very good. Thank you, Andrew.
Glad to hear it. So, if you could just introduce yourself for us, give us your name, your title, a short bio about yourself, your credentials, and then state the title of your article, please.
All right. So, thank you. First, I want to thank you for having me here this morning. It's always exciting to talk about an article. And my name is Fidel Lim. I am a clinical associate professor here at New York University Myers College of Nursing. I am in New York City, and today I'm here to talk about an article entitled Urinary Tract Infection Revisited, Optimizing Best Practices. So a little bit of background by myself. I was an ICU nurse for about 18 years, so I did med surg as well, but right now I'm full-time nursing faculty teaching undergraduate students.
Fantastic. So, could you briefly just give us an overview of why nurses should read your article?
So this article provides an overview of the pathophysiology, the manifestations, diagnostic markers, treatment. I'm talking about antibiotics, nursing care, the evidence-based protocols in preventing and managing catheter-associated UTI. So it's a topic that's very familiar to many clinicians. Maybe all clinicians are doing some form of UTI care right now, because UTI is, according to the data I've seen in the statistics, it's probably the most common urinary tract infection out there, which accounts for about 8 million visits a year to various healthcare environments, hospitals, clinics, outpatients, that sort of thing. And catheter-associated UTI, which is the UTI you get from having an indwelling urinary catheter or instrumentation into the urinary tract, is at the moment the second most prevalent healthcare associated infection. So it's significant. And last year, 2022, the CDC had reported that about 22,000 cases of catheter associated UTI was reported in the United States. So it's significant. And I also like to, nurses out there, clinicians, to realize there's been significant improvement in the reduction of the number of healthcare-associated UTI. However, we are still seeing great numbers, like 22,000 cases a year. So that's really what I'd like them to see in this article, to have an overview and remember what they already know and continue doing what they already do so well.
Amazing. So, you said this is a topic that you're revisiting. What made you want to revisit this topic specifically?
So, as a writer of clinical topics, I have sort of a personal interest in this. So, as my role as a clinical faculty, I teach undergrad students med-surg, fundamentals in nursing, pharmacology, and critical care. So, by writing topics that are important like UTI, it gives me an update of what I'm supposed to teach and what I'm supposed to have my students do, in their profession. So by writing this, I am inspired to get updated in the latest science in the care of patients with UTI. And there's always so many changes happening out there. The protocols are always getting updated, and we are always getting new technology and other equipments that are used to address infections such as UTI. So we have now other means to, for example, manage incontinence without using an indwelling catheter. So that's really my interest in writing this article, because in nursing school, we teach our students to safely insert catheters, right, to make sure infection control is observed. But at the same time, I would like them also to advocate for the removal of urinary catheters when they're no longer needed, because we all know this, that insertion of catheters is one of the most common reason for catheter-associated UTI, accounting for about 75% of hospital healthcare acquired urinary tract infection. So yes, that's why I want them to get updated on this.
Well, that's a lot of good information that you're giving them. So with all the information that you will be giving the nurses who read this, what are 2 to 3 things that like specifically you want them to like zero in on from this article?
Yeah, I'd like the readers, nurses, clinicians out there to continue to think and remind themselves that urinary tract infection remains an epidemiologically significant infection in the community and in the hospital. I would also like the clinicians out there to be more conscientious in having those catheters out, removed from the patient when they're no longer needed. So by advocating for prompt removal of urinary tract catheter, we can definitely, as nurses, influence the prevalence in a good way of urinary tract infection. So nurses are a great part of the team that can address hospital healthcare associated infection. And catheter-associated UTI is considered a nurse-sensitive measure. What we mean by that is it's a specific patient care outcomes that is mostly influenced by nursing care. So CAUTI, catheter-associated UTI, is considered a never event. So it means it should never happen because it can be prevented. So my takeaway for nurses who read the article is to redouble their efforts. That, you know, every time you have a huddle with your team and you're reviewing a plan of care, you can simply ask, do we still need a catheter? I think that's a great way to propel the conversation to caring for and preventing urinary tract infections, especially in healthcare settings like hospitals, long-term care facilities, rehabs, all those places. So, and the last thing I'd like the readers to get to take away with this article is to continue implementing the evidence-based protocol in addressing urinary tract infection, such as, you know, giving that antibiotic promptly, right? If your patient is urosepsis, make sure that we follow the protocols, the COTI bundle, the sepsis bundle. So all of that meld together for better patient outcomes and prevent adverse effects.
Amazing. Well, thank you so much for writing this article for us. We really appreciate it. And thank you again for sitting down and talking with me a little bit about your article today.
Thank you, Andrew, and a pleasure all the time, and happy holidays.
Happy holidays to you too.